Dr. P here, and today I'm going to share with you 5 questions that you should consider asking before scheduling adult ADHD testing. Now, let's get right into those 5 questions. So the first question that you should ask before scheduling adult ADHD testing is, what is included in the testing? There are 3 main parts that you're looking for to be included in testing. The first one is an in-depth interview. So this interview will be with you, and it will be about everything that's going on with your current functioning, symptoms you're feeling, but also your experiences in childhood, in school, the workplace, etc. So this is really an in-depth and comprehensive interview looking at how ADHD or the symptoms that you are experiencing have been impacting your functioning throughout your life. In addition to that, the person who is doing your testing may also interview someone close to you, like a partner or spouse or even a colleague. And the reason for this is that a lot of times those closest to us can provide information about us and how we're doing that maybe we won't think to share, or maybe we don't even realize, but can be really helpful in getting us an accurate diagnosis. The second component of testing is something called rating scales. Rating scales are validated, so they're research-based questionnaires that are going to be sent to you either through a link emailed to you from the clinician who's doing the testing, or by providing you with a link to go to do the testing online. Some rating scales are also still done with a piece of paper and a pencil or a pen right in your clinician's office. Rating scales give us a lot of information about the kinds of symptoms you're experiencing. They might ask questions in a different way, and they really help us make a more accurate diagnosis. Again, with rating scales, you may choose someone close to you or who knows you well to complete a set of the rating scales. So again, we can get the most comprehensive picture of what is going on for you. The third part of testing are the assessments themselves. And most of us are familiar with assessments like IQ testing or cognitive or even achievement testing. Some or all of these may be included in your ADHD testing, depending why you need ADHD testing done. So for example, if you're an adult and you're thinking about asking your doctor for medication or just trying to see if medication's right for you, you may not need to have something like achievement or IQ testing done as part of your evaluation. However, if you're a college student or a grad student looking to go back to school and you think you might need some accommodations to help you with exams or even being in class, then you may need the IQ or achievement or other testing. This is a great and really important question to ask the clinician who will be doing your testing, because they'll be able to tell you if that is included in the testing or if you need to have it. So those are the basic 3 components that you want to look for when you ask about what is included in testing. The second question you want to ask when you book adult ADHD testing is, how long is this going to take? Now, by that I mean both. How long is the in-person testing? How long is the process from start to finish? And how long until you get your final results? So a few questions about how long. But this way, you're going into the whole experience with a really realistic idea of how long you might have to wait. When you reach out to a clinician to get your ADHD testing, you might find out that there's quite a long waiting list. And so you might want to consider that in the time it's going to take to get those results. If you have some time pressure, let's say you are taking a licensing exam, then you might want to consider that. Another thing is that from the time that you actually start the testing or your first intake appointment till you get your results can vary quite a bit among clinicians. There are going to be clinicians or clinics that can provide those results to you within a matter of days or even a same day diagnosis in some cases, all the way to taking months to get back to you. So it is really important that you ask up front how long testing is going to take so you can make sure it works for your time frame. The third question that you might want to consider asking before you schedule ADHD testing for adults is, what is included in the final report? So all testing will result in a final report for you. And that could vary from a 1-page summary or just simply your diagnosis on a 1-page summary to a comprehensive and lengthy report. The report really matters in that it meets the requirements for why you're getting the testing. So if you are trying to, for example, seek medication from your psychiatrist or your PCP, a one-page summary might be enough to help you navigate the medication. However, again, if you're looking for accommodations, as I previously stated, you might need a more comprehensive report that shows the different results and interpretations of those results. In addition to the length of the report and how much it contains, you could ask questions about things like, will my report include recommendations? So testing can tell you whether or not you have ADHD, but it can also give you a lot of information about why you're struggling and specific areas you're struggling with. So a recommendations section of a report can help you by giving you really specific recommendations for what might be a helpful way for you to manage those challenges. Medication might be one of those things, extra time on a test might be one of those things, but there could be other things like executive function coaching or therapy. So asking up front what kind of sections are included in that report, will there be specific recommendations made, could be helpful to you so that you know you're getting from the experience what you're hoping to get out of it. The fourth question that you might want to consider asking before scheduling that adult ADHD testing is, how much does testing cost? Now, there are a couple options to pay for testing. One option, of course, is to go through your insurance company with someone who is in a network with your insurance. When you do that, you may still have some part of that payment that you are responsible for. For example, a copay or co-insurance. So those are questions you're going to want to ask up front. Now, another option to pay for testing is to go outside of your insurance and get a private evaluation. In a private evaluation, you are most likely going to be expected to pay at least part of the fee up front in cash, credit card, or check. However, the clinician accepts payment and the resulting amount at some point during the testing. Some clinicians may require that whole amount up front, and some may have more of a payment plan or a payment structure that kind of allows you to spread out those payments. Now, going outside of insurance to get a private evaluation has some pros and some cons, right? So some cons are that it does cost more money to you. That's the biggest one, really, is that it will cost you money out of pocket to get that evaluation, whereas going through your insurance, the insurance will cover the bulk of it. So why would you even consider getting a private pay evaluation? So here's a brief overview of how testing works with insurance. In order for insurance to cover your ADHD testing, there has to be something called medical necessity. Insurance wants to approve testing that they feel is medically necessary for you to get the care that you need. And in doing that, they're also going to have a say in which assessments get completed and how long the clinician is allowed to take to do those assessments. So that leaves clinicians with the decision to either try to use fewer tests and fewer measures in order to make that diagnosis and kind of fit the evaluation into the time provided by the insurance, or to do some of that and realize they're just not going to get paid for it. With a private evaluation, on the other hand, your clinician has the ability to select the best tests to provide an accurate diagnosis for you. Now, this may mean that they can take more time with actual assessments like IQ testing or achievement testing or any other testing that they feel will help them clarify your diagnosis. But it also means being able to interview you, someone else, and maybe even beyond that, other people. For example, if you are in school or if you were to schedule an ADHD testing for your college child, maybe a teacher, professor, or a coach that also could provide some important information. So in private pay testing, we're not confined to just those hours and just those tests that insurance say are what's necessary to diagnose. Now, is there a right or wrong here? Absolutely not. There are great clinicians providing very accurate diagnoses and taking insurance, and there are also great clinicians providing very accurate diagnoses and not taking insurance. The difference is, of course, that once you go through insurance, they do have the information about whatever diagnosis comes out of that testing. They can dictate the length of testing and the amount, or excuse me, the tests that are used. And they can also elongate the process in testing because it can take a while to get pre-authorization for that testing. Whereas with a cash pay provider, there is more focus on the quality of the testing and the experience of testing for you, and your results are private. They're just for you. Another note about cash pay testing is that there are a couple different ways that clinicians may charge for testing, one being a flat rate fee. And so that is when a clinician charges only one rate and any and all testing that you will need to have an accurate diagnosis is included there. Now, the nice thing about a flat rate is you know upfront exactly what you're going to pay, and you know that no matter what kind of testing you need, or if there are extra tests that are needed to clarify something, if something seems unclear in testing, that will just be included. Now, for somebody who charges by the hour, it's a little bit different. They will present to you their good faith estimate. So as required by law, they will let you know how much they can foresee the testing cost. However, that could be variable depending if you need to add extra testing, if things take extra time. So there's a little to consider there. Again, no right or wrong, just information for you to know when you make your decision about who to go to for adult ADHD testing. The final question that you might want to consider when you book your adult ADHD testing is asking who gets the results. So, as I stated previously, if you go through your insurance company, that means your insurance company has access to your testing and results. They may just have access to your diagnosis that comes out of testing, but they also may get access to the report itself and the testing data. So that's just something to consider. If you go with a private pay practitioner and pay out of pocket or separately from insurance for your testing, then your testing results are yours. And only you get to decide who gets access to those results. Here again, you can sign something called a release of information so that those testing results can be provided to your doctor to help facilitate treatment, or to anybody else that you think those results would be helpful to have. That's it for today. If you are in California and you're interested in learning more about ADHD testing for yourself, you can find a link to my website below, and I will see you in the next video.